I'm just checking something. How are you guys this evening? I've got a timer because I'm going to put this on YouTube. So I want to make sure I don't go over the 15 minutes that I want to put on there. So we're going to go over the nervous system, but I also have the endocrine system attached to this. This is the Sapphire course. This is the endocrine system. These are the lesson plans. These lessons you guys can look at anytime you want to. Right now, there are 13 lessons. I do have definitions to put on here. I'm going to add those later. Okay, so when you guys see this, this means that I have a slide here. It means that I have taken something from online and I want you guys to see it. I'm not going to click on it, but if you go into the classroom, you can see it and you can click on it and it's going to help you with your classes. Okay. This is pretty much a summary of what we've done and what you've completed. So if you guys see this as a CPC guide handbook, when you guys get your CPC guide in every chapter that you do, as far as the cases in the back of the chapters, just check it off as far as what you've done. If you've done work in this step-by-step book, check it off. That's what you've done. If you finished your case studies, check it off. That's what you've done. Okay, your chapter review questions, check it off. That's what you've done. And that just keeps you abreast on, what you've done already, because you don't want to be repeating yourself unless you have to review. Okay, so this is pretty much how your class starts off. This is the beginning of the endocrine system, which is chapter 12 in your CPC book and in your Sapphire guide and in your classroom. So there are a lot of things that I've added into the classroom that has to do with your CPC exam and a lot of things to also go over. So this is what it will look like. I'm not going to go through step by step of what's going on in the classroom because this is a YouTube video. I'm just showing you what is in the classroom and what you will be going over. Okay, and this starts with the anatomy of the endocrine system. Now, I'm not going to go over this one, but I am going to go over a little bit of the nervous system. I just want to go through some of the lesson plans so you can see how and what we do. It's not going to be a boring class. I mean, you guys see little animations here that sometimes I do. This one says, hello class. Today we're going to talk about the nervous system as it relates to the endocrine system because it's adjacent to each other. So just, take heed to that. A lot of things are connecting, which is adjacent. That's what I'm saying. And these two I did put together because I wanted you to see how they connect, the nervous system and the endocrine system. You guys see my email below, so just make sure that you contact me if you have any issues. Let's just move on just so you can see some of the other things that are in the classroom. Encephalitis, that's brain, okay? Welcome to lesson 5 of the endocrine and nervous system. In this lesson, we are currently discussing ICD-10 CM. And you guys know all of the lessons start off with ICD-10. We talk about ICD-10 first, and then the second part of it, we start talking about CPT. This is every lesson that you have, okay? So you're going to go through this. You can read this on your own, or you can get the recorded archived course that's in the classroom. This course, you can print this if you want. I don't mind if you print it. Just be a lot of printing. There's a video in there with me on doing this course. You can archive it as much as you want to. Even this, you can archive it as much as you want to. So again, you'll see these are definitions, and this is just a few that I just put in here to make sure that you are familiar with these terms. Encephalomyelitis. Make sure you are familiar with that. That could be on your test. Insomnia, hypersomnia, sleep apnea, parasomnia. Make sure you get your index cards and write this down, okay? Because you're going to need to remember these things when you take your exam. This is lesson 5. Listen, when you are studying for your CPC exam, make sure that you study what you think you cannot retain. The stuff that you already know, that you already have up here, You don't need to retain. You don't need to keep going over that stuff. I want you to go over the stuff that you think will be hard for you. Okay. Migraine, disorders of the nervous system. Okay. I have this here because I'm letting you know that we have Google Drive and Zoom. We have TikTok, we have Facebook, Instagram. There's no reason you guys cannot reach me. None at all. Okay. Good evening. Let's get started. You see how this is? This is all the classes. This is how it is. When you miss something, if you don't get in on a live class, no problem. Go ahead, write it down. Let's say lesson 7, migraine and disorders of the nervous system. You want to go over that? Go back and archive it. I mean, you can play it, over and over. If you see me put codes in here like this, I want you guys to look up these codes, 49320. Every code that I put in here, look it up. You're going to feel like you're going through every single page of your CPT. Good, because you're going through every single page. CPT coding for endocrine nervous system. Okay, make sure that you read everything that I put in here. Hello class, are you ready? Through the roof. You guys know I always like saying through the roof. Okay, put your thinking caps on and your books open. We're going to start with the endocrine CPT, then move on into the CPT for the nervous system. So at this point, this is where we're going to start talking about the CPT. Not that, I just didn't go over the ICD-10, but the ICD-10 is pretty much cut and dry. Most of your documentation, you're going to find the notes. Okay, in the notes, it's going to tell you what the diagnosis is, and you'll find it. Go to the index, you'll find it. Go to your tabular list and check it. Okay, so I'm going to skip down with this because I'm not going to go over all of this because I did write down some things that I wanted to kind of talk about with you in regards to the nervous system. This is lesson 9, just so you guys can see what is in lesson 9, endovascular therapy. Endovascular therapy. Now, most of the nervous system you guys know are in the 60,000 series, but there is a portion of the nervous system that is in the medicine section. So take heed to that. In this lesson, we do move to the medicine section. The sleep study portion, I'm going to do separately. Okay, I'm going to do that separately. I just wanted to touch bases on the nervous system. We're going to touch bases on the spine. We're going to touch bases on pain medicine, toleration of pain, paddles. This section has all of that in there. What I'm going to put in here, I'm going to go ahead and add the sleep study. Right now, we stopped at lesson 13. I'm going to try to make it only 15 lessons, but that's a whole different category because I've got to show you how to navigate through that medicine section. Those of you who have done the medicine already, this should be cut and dry for you when you get ready to go through the medicine section. Okay, so this is just letting you know, this is how the classes are. Hello, in this lesson, we will discuss the spine and the spinal cord in this lesson. We'll discuss seizures. Okay, I'm not saying it right. Seizures, as well as injections. So, just take heed to what's in here and you'll get through it. Put it in your phone. I have students that put this in their phone and, they don't have you're in the park, you're strolling, you can still study. You guys know that the test was broken down to 4 hours. So that's better than 5 hours and 40 minutes. Okay, this is lesson 11, catheter reservation pump implantation. It's a device that they put on your side, and in your back, they put like a catheter in there, and you press this thing and it gives you medicine. So when you're in pain, you can hit it and, you get all the medicine in there. Okay, and stop that pain. Nerve block. You guys got to see this in the classroom, I'm telling you, because a lot of women are pregnant and they really want to know, well, where does that needle go? Does it really go in your nerve? Does it go in directly your back? Where does it go? Well, let's read and find out. Hello, everyone. I'm glad to see that you are in the surgery section of the CPT manual. And that's how it starts. Okay, involving the nervous system. Everything in here is not going to be perfect. I see a couple of errors in here that I might have had in here. But I'll probably fix those as we go. I'm not really concerned about a word error or XYZ error. You guys better know what I'm trying to say. Okay, because you've got to pass your exam. Okay, if you're not clear on something, give me a call. Okay, anything in here that I think looks funky, I'll correct it at some point. But right now, let's get it going. Anyway, okay, so again, there are 1, 2, 3, there's 12 lessons right now. And I think I have 13 lessons in here on nervous system. Has nothing to do with the sleep study. Now, sleep study is a part of the nervous system, but right now I'm going to leave that for a second section. Okay. Extracranial nerves and the autonomic nervous system, 64400. Pay attention to this one right here. If you have your books, let's go over this one real quick. This is nerve block diagnostic therapeutic. Therapeutics is what can we give you to make you feel better? What can we do to make you feel better? It's pretty much medication. So in this case, it says for extracranial nerves and our autonomic nervous system, basically you're going to go to the code section 64400 through 64495. You have your books. Go ahead and turn to that section. I have my book. My book is open, but I just want you to go to that section so you can kind of get a look at that. These codes are for extracranial nerves only. Go to the heading and highlight it. The description is pretty big. It's written in red. Okay, when you see those red descriptions, that's the title of that full section. That's not the subsection. That's the title of the section. Okay, so you know that they are extracranial, but this is the tip. When you are looking for extracranial, they are not in the 64,000 series. Go to 61450. That's why I put that in blue for you to go there. Okay, 61460 and 61790. Okay, make sure you highlight it. Okay, when you get to 64400 and you're looking for extracranial, okay, that's there. But when you go for intracranial, it's not going to be 64496, 64497. You got to go to 61450. Put a note next to 64400 that intracranial is 6145. Go to that area. Okay. I'm going to hit the speech right here. Again, there's not going to be much in this section. CPC just wants you to touch bases on this, which at the end of this, that's what it's going to be all about anyway. I'm just touching bases with you on what's in that bottom half of that test. Okay, not necessarily the bottom half of the test, but what's in the bottom half of this section. Okay. So again, nerve block, diagnostic, and therapeutic. Make sure you hit that. And basically, you're just looking at it just so you will be abreast when you get ready to get it. Remember, your test is multiple choice. Whether you take it online or in person, it's still multiple choice. Okay, so lesson 13, nervous system. Hello, class. Now, I always say welcome. So always welcome everybody into the class, even if you're working independently. And when I say hello, class, I just mean somebody might be on in Canada. Somebody might be on in Virginia. Somebody might be on in Georgia. I'm really talking about all of you who are in the classroom. Okay, so hello, class. Welcome. Okay, in this last segment of the endocrine system and the nervous system course. It has been a long course, so let's end it well. This is a long course. There's 13 lessons in this alone, okay? These few topics that I'm going to mention, I'm just going to give you the description and the codes, and I want you to look them up. So I'm not going to go into detail with them because I want you to get to the sleep study, okay? Be done with this because we're going to have fun with the sleep study. That's why I'm doing this separate. So neuroplasty, I just added that in there because I want you to be abreast on that. Okay, anything with plasty is pretty much trying to repair something. Okay, transection and avulsion. Transection is to divide by transverse incision, and avulsion is tearing away. The code section depends on the nerve that is targeted. Make sure you read your guidelines and your parenthetical notes. If the procedures are bilateral, make sure you are coding it correctly. If left and right is already there, okay, you do LT, you do RT. If bilateral is already there, You don't need to use the 50. Okay, so don't use the 50 if you see it. If it's already in the code, do not add 50. Neuro, this I always get this word. Neuropathy, that gotta be it. Okay, those of you who have went over the medical terminology, you see this thing going off? I gotta stop now. Those of you who have went over this in medical terminology, just go over it again. Okay, so right now I got through the 13 lessons. Let's cut this, and then I'm going to have to start again with what I wanted to do, because sometimes YouTube doesn't take the Zoom codes. So the Zoom codes, you know what I mean, the full 20 minutes that I want to do. So I'm going to end it now, and then I'm going to start it again. So there'll be a second video, but I'm just going to drop this on there just so you can kind of be abreast on what's going on right now. This is the nervous system. The nervous system is completed. The only thing I'm adding in this is the sleep study and the definitions. So when you go in the classroom, that's what you're going to see. Okay, so I'm going to sign off now. I'm going to stop the video, and good luck to all you guys, and make sure you subscribe to my channel. Okay, call me. Okay, my phone number is on the website. My emails are on the website at lbcfink@sapphirecoding.com.